Hi, I'm Angelica Quiroz, and today I'm going to talk about how the healthcare system has focused predominantly on men and how it's caused way too many women not to get the help that they deserve. So with my research, I've discovered that women are somewhat overlooked in selecting patients for clinical trials. With the coming forward of this project, I want there to be a spike in research on how diseases affect women and for more women to be allowed in clinical trials. There also isn't enough word out on this topic anyways, so I do hope that more light will be shed on this. In doing this research, I did end up finding more sources not through the school library website. So I'll basically be talking about bridging the gap in women's healthcare research. The study of diseases and how they affect women has been overlooked by the medical and scientific communities. In the past, most health research focused on men, leaving a big gap in our understanding of women's health. Heart disease, for example, is often seen as a men's issue, but it's actually the top cause of death for women in the US. However, the way we diagnose and treat diseases is mostly based on the studies done on men. This oversight can lead to women being misdiagnosed, getting treatment late, and having worse health outcomes. So I found this in my first source, Women with Heart Failure, Unheard, Untreated, and Unstudied. So in lack of research, diagnostic criteria and symptoms used in research and clinics are based on men's studies. This leads to misunderstandings of how diseases show up in women, like heart attacks. So women might have different symptoms, like unusual chest pain that doctors might miss, leading to them underestimating the risks and not taking enough preventative measures. In healthcare access and quality, women, especially those from marginalized communities, already struggle to get good health care. So that is just awful. The lack of research makes this worse because it ignores how women's bodies, hormones, and social factors affect their health. And this is in my source of ischemic heart disease in women. Are there sex differences in pathophysiology and risk factors? Okay. So women might not get the right care, keeping the gap between men and women's health outcomes wide. The importance of research is that we need more studies to understand how diseases like heart attacks happen in women. This means looking at the different symptoms, risk factors, and how women respond to that treatment. If we include data about women in healthcare guidelines and train doctors to do better, they can give more accurate diagnoses and personalized care, which can save millions of lives and make healthcare fairer for everyone. So in conclusion, it's crucial to fill the gap in research on women's health by doing comprehensive studies and including women in healthcare guidelines and education, so we can make sure that women get the right care they need, improving their health and saving lives.